today is the second Sunday of the month. We strive to inform the community about health matters. So today we have our guest, very interesting guest who's going to really enlighten us and make us proud also, being Haitian American and being a woman. And then the second part of the show, we'll talk about the update about the COVID-19 pandemic, what is at stakes, the variants and the vaccine distribution, things are going. So without further ado, we're gonna welcome um, Kelleen Edmond. She is the president of ANA, which is the Asian American Nurses Association, and we're gonna spend some good time with her, and she'll serve also as a template for other women to do likewise. All right.
So that I don't want to share the spotlight. This is your spotlight. So I'll be sliding over. I'll be behind the scenes sharing the show, inviting more people to come and watch.
No problem. Okay.
Thank you, Doc.
You're welcome. All right. So we're waiting for Kelly.
Hello.
How you doing?
Hello.
How's everything
I'm
going?
good, Dr. Benoit. All is well. It's a pleasure to be.
Okay, very good,
well.
very good. I see that you have a big title, and it's very impressive. I like that. So first of all, we're gonna try to know you a little bit more. First of all, tell us where you grew up, where you grew, were you born in Haiti, or were you born in here, and where you went to school, and how you got where you at now.
Okay. All right. It's a long story, but I'll give you the short version.
No, the long story is good because that will serve as a motivation for others. Despite the path was difficult and very tedious, you have maintained your perseverance and achieve your goal. So the treacherous road is always good to listen to.
Well, you're right. I guess you are right. You're absolutely right. I just before I begin with my treacherous story, I just want to say thank you to Dr. Mona Lisa Ferrari and Le Mojo Show for having me on. It is an honor to be here, and a privilege to be here and to share my story. My name is Kelleen Edmond. I am the president of the Haitian American Nurses Association of Greater New York. That's the Greater New York chapter. There are 11 chapters, and my chapter happens to be centered in Greater New York. And so I want to say hi to all nurses, all members, all women, since this is Women's History Month, Her Story Month. And I'm here today to share a little bit about my story. I am Haitian American, born in the United States, born right in Brooklyn, New York, by Haitian immigrants who migrated to the United States in the early 60s. I am one of 5 children that my parents have. And somehow through life choices, some that have been quite difficult, I find myself here on the Le Mojo Show to tell a little bit about my story. So yes, so born and bred in Brooklyn, New York, Park Slopes, Crown Heights, where I still live. I still live in Brooklyn. I have moved to Bed-Stuy, Brooklyn, and I've been here for about, I would say 10 years in Bed-Stuy, but I am a Brooklynite at heart. But at some point of my adulthood, I decided to embrace my Haitian roots when I really saw and began to understand what it means to be Haitian. Though I'm not going to say that my parents didn't instill that in us. I think sometimes when parents migrate, they have reasons for leaving their country, and so they try to steer their children in a different direction. Not to say that you're not Haitian, but to really assimilate into the American culture. And so I assimilated so much that I assimilated myself right out of my parents' home at a very, very early age.
That's quite an assimilation.
Yes. And I think they were shocked because I left home really, really young, because I just didn't want to be under the rules. I had very strict Haitian parents. My dad was very strict. My mom equally as strict, Seventh-day Adventist. So I was under the spotlight of religion and being, held at a curfew, and just some things that as a growing teenager, getting closer and closer to 18, that I really didn't want to do. So one day I got brave and I packed my bags and I went and I stayed with a friend of mine, and it was no turning back. Like no matter how hard the road was, and the road was very, very hard sometimes, I just didn't want to go back because I wanted to be on my own really early. And it wasn't easy. And it didn't start off so wonderful because then I started having kids really, really early.
Wow.
5 boys to be exact.
Wow.
Yeah, 5 boys. And now I walk down the street and people think, that's my guy, my man or something, because they're all grown and big now. My oldest, 28, 29 years old. I originally went to LaGuardia Community College, where I obtained an associate's degree in mental health and human services, because when I went to become a nurse, I was told and believed my biology professor, which I won't say a name, but he told me, I don't think you have what it takes to go into nursing. And I let that change my course for a very short time. And so I went ahead and followed the path on mental health and human services. I worked for a couple of agencies, direct care work at first, and then mental health and mental health therapy until about 1998, when I had my 5th child, my 5th boy. Actually, excuse me, I take that back, my 4th boy. And he was born with several medical issues that eventually took his life. And he died he died very, very, very young. And it was during that time that I realized that I needed to pursue becoming a nurse. I was home, a mom, not a single mom, but a mom taking care of my kids, one of which was born with renal issues. Oh, you're a nephrologist. That's
Yes.
right.
Yes.
So he was born with posterior urethral valves at birth.
Wow.
So,
okay.
So his kidneys were a mess from the minute from the minute he showed up. And because of those valves, his lungs were underdeveloped. He didn't breathe the right way in utero. Of course, I didn't know any of this because I wasn't a healthcare professional at the time. I was just a young mom, just trying to make ends meet and taking care of my kids, just day in and day. And it was while sitting in the hospital and observing these nurses who looked like me. And when I say looked like me, they were brown and black nurses at Brooklyn Hospital, right downtown on 121 DeKalb Avenue, because those are the nurses, many of them who are still in the NICU, inspired me. And I said, oh my God, these nurses are as smart as the doctors. And that struck something in me. And I decided to go back. And during my my journey, I was told, you have 4 kids, and I'm like, yeah. And they said, you can't do this. You can't go back to school full time. And I mean, the level of discouragement that I received, and I said, no, I was told no before, and I'm not going to take no as an answer.
Wow.
So I enrolled. I didn't know how I was going to do it, but I did. At that time, I was taking care of, his name is Akur. He was ill, as you know, I mentioned. I studied, worked my way through prerequisites. I went to Long Island University School of Nursing in Brooklyn. I earned a bachelor's in science, a concentration of nursing, and I went to work. And somewhere between 1998, when Akur was born, and 1999, when he died at about 15 months. The pediatric nephrologist told me, listen, babies who are born like this generally don't live to be, don't live past a year. And I was, grateful and honored to have him in my life for a whole 15 months. And it is that experience that speared me into the nursing profession. It was a heart-wrenching, heartbreaking decision. I walk around with a hole in my heart that it's never really healed. When you lose a child, you carry a child and you care for a child. That hole never closes, but you learn to live and deal with the pain. And I've learned to deal with the pain, and it's over time gotten better and better. And I think of him every day, and every time I interact with an individual, I try to make differences in people's lives. I remember him, and so he is that's my legacy, living, breathing through me, through the career choice that I made. So in my head, I thought I was going to be a pediatric nurse or a NICU nurse or a labor and delivery nurse because of my experience. But when I got to the floors and started working with adults, geriatric adults, gerontology is my specialty, adult gerontology, I decided that I wanted to work with adults. So I stayed basically working with adults, decided to go back to get my master's. While in my undergrad program, a lot of my instructors were saying, you have a knack for teaching. I used to tutor my peers, and they said, you should consider, teaching. And while in the master's program, I was approached by the chair at the time, Dr. Candy Dado. And Dr. Candy said, you want to try? I'm going to give you a clinical. And I wasn't even out of a master's program. And I jumped on it because I did love teaching. And after concluding my master's in nursing at Long Island University, I went and I worked as an NP, adult geriatric, held numerous positions in primary care, working in skilled nursing facilities, working in school health, and then veering off to where my passion is and lies, and that is teaching. And so, funny enough, I ended up getting my adjunct position at my alma mater, where I went to school. I was subsequently hired, and I worked there as a director of laboratory resources and clinical education for a number of years. And then I got offered the opportunity to go to CUNY, City University of New York, where I was an assistant professor for a number of years, teaching at Medgar Evers College in Brooklyn. And I mean, it goes on and on and on. In 2014, I was given, while at Long Island University, they gave me a graduate student to work with. Little did I know that this graduate student was a powerhouse of a person. She would show up after work religiously, getting in her hours. Professor Edmond, she was, older than me. I looked up to her, and I didn't even know who I was dealing with until one day something said, why don't you look at her CV? She's your GA, but look at her CV. And it's Dr. Marie Hippolyte. And she at the time was the sitting president of the Haitian American Nurses Association. And she would tell me, I want you to come and see what we're about. I want to invite you to a few meetings. Come. So I came, I saw the work involved, and I would tell her, I'm not ready, because I watched her and it's a lot of work. And I would tell her, I'm not ready. Eventually I transitioned and ran for a position to be the vice president of the organization, which I was able to serve a term as the vice president. And then I actually did 2 terms. And then I ran for the presidency. And I believe that was in 2018. And she stepped down and I became president, and I ran again for a second term, and I'm in my second term now. So the road to where I was has not been easy. Believe it or not, by choice. There was some times where I had these babies and I didn't even know how I was going to feed them because I was on the stubborn side, and I refused to go back home to my parents because I wanted to show them that I can do it on my own, and that, that I had the wherewithal. So I, had a lot of self-inflicted trauma because of that stubbornness. But I think that built character. I think that built resiliency. I think now when I stand in front of my students, and I should share with you that I currently work for the Department of Education at coordinating a LPN program at Clara Barton High School. Clara Barton is very well known for their nursing programs. And these are secondary students. That means these are 11th and 12th graders. And, so these kids, they kind of live on Google. So they just, when they first met me, I was just the teacher until one day someone decided, let's Google, let's Google her. I came into the classroom and they were like, oh, Miss Edmond, you're not just a regular teacher. Like, we see all these things about you on the internet. And that inspires them. And when I told them that originally I was told no, like many Black and brown kids are told, no, you don't have what it takes. No, you want to be that, but that's probably not what you should do. Well, what should I do? Well, become an NA. Go to, go into a nursing program, become a nursing assistant, become a home health aide. Those things are easy. But you have to go by what drives you, what's in you, let your spirit lead you to those, to those choices. And my mom would tell me, I was spending some time with her today, and she said, my mother is a nurse by profession, was a nurse trained in Haiti. And she said, I always knew that you would be a nurse. But then she said to me, you didn't really have an option. You either had to be a nurse, a lawyer, this is a Haitian family, a nurse, a lawyer, a teacher, or a doctor. She said, so either way, I knew you were going to end up in those areas anyway. Yeah. So the road was not easy, but it was actually, could it have been easier? Yes, I'm sure, if I had made certain choices. And if I had to do it over again, would I do it over again and make different choices? Probably not. They say hindsight is 20/20, but I would not have had the opportunity to meet Akur, my son. I would not have had the opportunity to be exposed to what true, educated, beautiful Black and brown nurses are. Did I know when I went through that journey that I would be a lead or a face of a nursing organization years, decades down the line? No, I didn't know that, but I wouldn't change my trajectory at all, not at all.
That's, as you trying to lay out the path that you have taken, it sent chills down my spine, because you see, at first you were a little bit hesitant to lay out the path, and the path exactly was going to serve a lot of our Black sisters listening to you. And I'm sure tonight, this evening, there are millions of sisters who are in the same predicament, and your journey should serve as an inspiration. And I think that, again, you said that such a path has created in you some kind of resiliency and character. And I think that you will you will take that baton and give it to your students, so they can do the same. I'm very proud of you. I'm very proud of you. Very proud. Very proud.
Thank you.
Very proud. Now,
thank you.
Now, you said that your parents had said you could do 4 things: either a nurse, a doctor, a lawyer, and the 4th one is what again?
Was a teacher. Teacher.
Okay. Now, you have accomplished one of them, the nurse. Are you going to accomplish any others that you want to accomplish in the category that your parents wanted you to accomplish?
So if you think about it, I've already accomplished 2. So I am a teacher. I'm a nurse educator. I teach nursing. I'm a clinician. The doctor part, it will not be a medical doctor, but PhD, yes. And that is soon to come. I am a student studying nursing education, and so that is really around the corner. So it's 3, so I had to explain to my mom the other day. Yes, I had to explain to my mom, and my mom is not 100% well. We recently found out last year, after she had a bout of COVID and was hospitalized, that she has stage 3B multiple myeloma.
Oh wow!
Which is tough.
Tough. Yeah.
I mean, she's just a rock. I mean, I can't even, explain, the amount of pain that this woman was in. And we were all, even myself, because, just chucking it up to being old and arthritic. You got to listen to your patients. You know what I mean? I would take her to the doctor, and the doctor would say, "Oh, it's gonna go away. It's just aches and pains. It's arthritis. What do you expect? You're 84 years old. You have arthritis." Meanwhile, she's got multiple myeloma. So, and I think this is the first time I've actually shared that to the world. Many of my close friends know this, and this is an illness that not many of our people know about. And when I talk about our people, I'm talking about the Haitian American community. They don't know about this until it's already in the late stage, like stage 3B.
That's correct.
And it's a shame, because now she has CKD stage 4.
Wow.
She is undergoing chemotherapy, which has helped and has improved her quality of life, even though it was a fight, because at her age, she's like, "Oh, if that's what they say I have, just let me go. I'm such and such age." And I said, "Mom, we're gonna do whatever you want to do. So if you don't want to do chemo, we won't do chemo. You want to do chemo, we'll do chemo." And I guess she prayed on it, because I went into the hospital room, because I had my own plans. You were going to do chemo. I went into the hospital room one day, and she was like, "Oh, I thought about it, and I'll do the chemo." And I think that was one of the best decisions she's made, because it's actually improved her quality of life.
That's good.
Where we were and where we are now is totally different. So yeah, So to go back to that, yes. So I'm 3 on that list. I won't ever be a medical doctor, but they will be
No, but
calling me a doctor.
it doesn't really matter that you have accomplished 3 out of 4. That's extraordinary. Now, talking about multiple myeloma, you said something that's very important. And that's something that I've acquired over time. And most doctors do not listen to their patients because the diagnosis lies in the history, not into the CAT scan, not into the sonogram. Now, and again, the reason I brought it up because I'm sure that others will listen. Many elderly patients, mostly Blacks, they're at risk down the line for multiple myeloma, and there was a confounding thought that everything is arthritis, and if the doctor took time to listen to the patient, how severe the pain was, the doctor, and there's usually a hint in the laboratory. There's a hint in the laboratory that will propel the doctor to move forward. The reason why personally I'm keen on multiple myeloma because I'm a nephrologist. Because every patient who comes to me who's anemic and a Black person, to me has multiple myeloma, unproven otherwise. So I always look for it. See, I always look for it. So, but many primary care doctors do not know it, and so therefore that a lot of Black patients succumb just for the doctor not listening, and then they get diagnosed very, very late. Now, it is a beautiful trajectory. I love it. I'm enjoying our conversation. Now,
yes, I can. Oh.
Now, you're gonna tell us. I know you work as a nurse, then you work as an educator. You work as a professor, and now you're holding a position as a president of nurses. Now, tell me that from being a nurse on the floor till now, how were you able to maneuver yourself? What is it like to be a nurse on the floor? What is it like to be an educator? Which one that you enjoy the most?
Well, I enjoy all of them. That's why I can't seem to give. That's why I can't seem to give one up. Because when I move from the bedside and I remove myself from patient care, I feel like I'm missing something. I don't know. I like, my heart aches, and I've tried to move away from the bedside and say, okay, I'm just going to be academia only. And then when I'm in academia, I feel like I'm disconnected, because how can I bring, and people do it, don't get me wrong, because there's research, there's evidence-based practice. Just do the research, do the continuing education activities, and you should be where you need to be. But I always feel like I need to be connected to the patient for the patient experience. So that's why I haven't left. And that's why I would leave, and I would leave for like a year or two, and then something says, I need to see patients. I need to touch patients. I need to interact with patients. And so being the nurse on the floor or at the bedside helps me. I feel like it provides me with the knowledge, the skills, the abilities, so to speak, so I get the KSAs that I can bring to my students. And when my students realize, hey, she's still in practice, I think that validates what comes out of my mouth. And I don't know if you know this. Well, you should know this because you're brilliant. Being Black in America, you have to work harder than your white counterparts.
Definitely.
And I have tons of white friends. So for something to come out of my mouth, and for people sometimes to really value it, they look for my credentials.
Sure. Yeah. Yep.
You know what I mean? As
Yeah.
opposed to somebody who's maybe sitting in the position that I am, but
Mm-hmm.
is privileged.
Mm-hmm.
You know, they just take everything at face value. So I mean, I say that to say that being rooted in clinical practice as well as academia helps really, you know, to build a level of credibility for my students,
Mm-hmm.
especially those students who are, you know, on their tail end of becoming that nurse, and those young students who are in the 11th and 12th grade. That's Generation Z. That
Mm-hmm.
Generation Z, they are our future,
Mm-hmm.
and you know, they have a different learn because I'm teaching them and I'm teaching the adults,
Mm-hmm.
and they have a different learning style. You have to be so creative. Like some of the millennials, they're not in it just for the paycheck. You know, they have this a sense of you know, doing good, a sense of justice.
Mm-hmm.
It would amaze you. And so me being in that position, I think I would be torn if I had to leave a clinical practice, because I have the passion for both. And I
Wow.
can't educate, I can't teach nursing if I feel disconnected from my patient. And, and I
Wow.
and I and I want to piggytail on what you said as a nephrologist, and I'll share this with you. Um, when I was in NP school, when I was doing my rotation, I did my clinical rotation with a nephrologist, not very far from where I lived on Eastern Parkway in Brooklyn, and he was amazing. And I used to wonder why all these people would come, you know, from people would travel far away. He had the knack, and I understood this after the fact, of managing folks with these high blood pressures, because
Mm-hmm.
we know that having years of high blood pressure, what's it going to do to your kidneys? It actually will destroy your kidneys. So
Mm-hmm.
eventually you end in chronic kidney disease, etc. So I feel like it's just so apropos that here I am sitting on Health Matters with Dr. Benoit, who happens to be a nephrologist. So I think that's like totally cool.
Yeah, that's good. So you see, I think also you now realize that the impact that you're gonna have down the line on your students. Because I, for one, I became a nephrologist because of another nephrologist who happened to be Haitian, brilliant, brilliant. I never seen many person like this. So when I was in my third year of residency, and this guy was so amazing, and I said I wanted to be like him.
Wow.
He impressed me so much, and I became a voracious reader. I was a reader when I was resident one, but when I started to attend with him, I wanted to impress him so much. I was reading like crazy, and I would come up with clinical problems and try to impress him. But uh, he was so, his affect was so flat. Sometimes I would never know if I impressed him until at the end he said you are on the right path. And I was gonna go into gastroenterology. He said no. He said the best field for you is nephrology. And till today, I always talk about him. So I'm sure your students gonna talk to you, gonna talk a lot about you. Now, you have four boys, right? Now,
Yep.
and
Yep.
you and I'm sure that they've seen where you came from the start till now. How they
Hmm.
embrace that president Edmund now? How do they embrace you? How are they uh, do the same way you can impact on others? What's your impact on your children?
Boy, that's a big question. That's a big question. I want to say that I inspire them. I say that I want to say. I mean, I can say that I inspire them because my oldest is 27. No, 28. He just turned 28. You know, they'll tell me things like, "We're proud of you." I have a 26-year-old. That's Tony. And the other day, I mentioned something to him, and he like, when you're raising these, when you have kids as young as I was when I was having the kid, you know, kids, you don't really see yourself as the parent.
Yeah.
Because then you kind of drop them off with their grandma. Because I didn't want to live at home, but my mom sure helped me take care of these babies. You know, you drop them off as your parents, and my two oldest, it's as if we kind of like were brothers and sisters. You know, it's not until they hit their 20s that they realize, you know, we shouldn't be calling you K, because that's what they call me K this, K that. You know, so now it's like mama this and mama that, and I kind of it sits well with me because I realize, you know, these are my offspring, these are my children. I try to instill in them the many values that were instilled in me. And despite leaving home at a young age, my father used to say something to the effect that without an education, you will be nothing. That is tough. I have a 13-year-old. And one time I said that to him, he was like, "That's mean." Like, why would you say that to your own child? That is mean. And when you think of it, the words are harsh. But it's a reality, especially unless you get lucky and you hit it big. For our brown and Black kids, you need that. You need that. You need that to validate who you are. And unfortunately, the darker you are, the more you need it.
That's true.
It's true.
That's true.
Because you may be able to pass because you're light, and then you know there is bias and discrimination on that level, even within our own culture, and you know it.
True.
So, you know, so those are the things. So I really wanted to impress in them the importance of an education. So when I took the realm over of Hannah, I myself didn't understand the amount of work, because then, you know, you ask me, how do you kind of juggle? You teach, you this, and then you have Hannah. Hannah is a job in itself. And it's a job where I get there's no big paycheck. There's correct. You know what I mean? I don't walk into, you know, nothing hits my account every 2 weeks or every month from Hannah, but something hits my moral account, right? Something hits my community service, my ethical account. In that area, something hits the sense to do good and to help others. Now, in those areas, I'm rich. I'm rich. And and no one, there's no work that brings me such, I can't even explain the words, how grateful I feel when somebody makes a donation to help put a student through school. How grateful, how honored I feel when I see one of our nursing students in Haiti graduate from nursing school. How grateful and honored I feel when they tell me, you know what, I got a job, and they're living in Haiti. That's really, because you have, you know, young ladies and young guys who go to nursing school and their family put them through school and they can't find a job in Haiti.
That's correct,
you can't find work. unless you become really creative and inventive. And even then, you need financial sustainability to bring your visions to life, whatever it is that you want to do.
That's
so
correct.
that area, and they see my passion, my vigor, how much I'm passionate about this. And how will I see myself? This is my last term, and I'm saying to myself, I can't be Duvalier and just say, I'm going to. I can't be a mama doc and sit in this position forever. Somebody else has to take the reign, and then I have to position myself to make a difference, still remaining active and contributing to the organization, but really taking a back seat and allowing another leader to breathe life and vision into our mission. And so it has been an exciting journey. And I know in my position, it's really not even about me. It's about the people that we serve. It's about leading this organization under a pandemic. It's about being grateful, Dr. Benoit, that I'm alive, because last year at this time,
well, we're gonna touch on that. We're gonna touch on that. We're gonna touch on that. Now, before we depart from you, now, I know that you are doing the second term as president of ANA. But what is ANA for those who do not know what ANA has been doing? What's really what's really the basic principle that govern this association?
Okay, so what is HANA? HANA is the Haitian American Nurses Association. As I mentioned before, there are a number of chapters within the United States. We, HANA of Greater New York, have just celebrated a 10th year anniversary. HANA of Greater New York came together because of some founding members who are still members of the organization, one of which serves as an advisor, and the other one serves, the other founding member serves on the board as the corresponding secretary, and that is Betsy Pierre-Louis and Michelle Saint-Hilien, who after the earthquake in Haiti, wanted to make a difference, wanted to go down and save lives. So they mobilized a group of nurses and they went to Haiti.
No, let me tell you, I remember they were the first one done in Haiti. Anna.
So, okay, Hannah, yes. And so I'm glad you mentioned that, because it would be a huge disservice if I don't speak clearly to say, when we talk about Hannah, we have Hannah of Florida, who has been in existence for over 35 years.
Wow.
And they are the chapter who really began it all. Though we have varying missions and various visions, the different Hannahs, we all see ourselves as one Hannah, one sister, one brand. We are now under this umbrella where we have Dr. Marie Etienne, who is the president of Hannah International. And I'm hoping one day Lemojo would extend an invitation so that she can speak to the work of the Haitian Alliance Nurses Association International and the work that they're doing. But for us in Greater New York, we're here 10 years. Our mission originally came out of the need to mobilize healthcare professionals, nurses, to go down and make a difference in Haiti to help save lives. So fast forward after the earthquake, these ladies, they got together and they formalized this organization, which is rooted in community service. Community service, serving our community, both on a local level and on a global level. Health education, both on a local level and then on a global level. And last but not least, nursing education for the past 5 to 6 years, and maybe a little longer than that, because this started way before my term, helping students achieve their goals of getting through nursing school. Not only in Haiti, but here in the greater New York area. We have a scholarship program where we offer scholarship to academically deserving students in the greater New York area. We have the same scholarship that we offer in Haiti for the 2 nursing schools that are state-run in Haiti, Faculté des Sciences de Port-au-Prince and Faculté des Sciences de Okai, so FASIC and FSIC, or INIP, we would call it. We all offer scholarships. The students, they write an essay. We have a whole education committee. The education committee reviews the essay and they select the essay. We have a whole rubric and a criteria that we follow, and we select a winner. So that winner usually gets a monetary amount, hundreds of dollars, and they use that how they see fit. And then we have the tuition assistance program in which a nursing student, and this is in Haiti, in which a nursing student demonstrates financial need. Now, how you would say, how would a student demonstrate financial need? And those who don't know will say, oh, everybody in Haiti has financial needs. That's not true. Despite what you may see, you know, our country is in turmoil, because I'm looking at my Facebook stream today, everybody's like, free Haiti, free Haiti. Our country is in turmoil, but there are some people who live very, very nice lives in Haiti.
True.
We are seeing the horrible pictures of Haiti, even when we're not in this amount of turmoil and destruction and loss of lives. They never show us the Haiti that you and I know exists. The Haiti that people go back and forth, leave New York, go to Haiti for a month, come back, go to Carnival. People who have resources and access to those resources. And there are students in the National School of Nursing who can afford to be there. And then there are students who are penny pinching, you know, hoping that their family back home sends them money to help. So these students put together an essay and they demonstrate financial needs, but they must meet certain academic criteria. And for those students who are lucky enough to meet the criteria and submit a successful and well-written academic presentation essay, they get their tuition paid.
That's good.
The whole 4 years. And in US dollars, that's about $850. That's like nothing. So, and I'm saying that's not, and I don't want to be insensitive, because I shouldn't say it's like nothing. For those who, you know, have it, it is a small gift that you can give someone else that can help really change their trajectory and make a difference, because there are no financial aid programs in Haiti. There's no tuition assistance program. There's no government grant, etc. You might be lucky and find somebody who wants to put you through school. And you may have family who are well, you know, who can afford it, because you don't need to be well off to put somebody through a 4-year education, comparable to what we're learning in the United States for $850. So that is something that I am personally so proud of, that we have the ability to do, and we have the ability to change someone's life.
That's beautiful.
And it's not for them to come here, and I make this very clear.
Exactly, yeah.
Because what happens is they start texting or messaging me, oh, I'm done, I can't get a job, how can I make my way to the United States? And the goal is not for us to prepare nurses to come and practice here.
Yeah, exactly.
The goal is to prepare these nurses so that they can serve their community.
That's correct. Yeah. All right. So now let's move on. Now we all been affected by this pandemic. And I've been a voice, a constant voice for the diaspora, for the community at large, since this pandemic landed in the United States. I've been trying to keep the community abreast with all new developments. Now, and based on the study, 1 out of 3 Americans know somebody who had COVID. And the numbers, all of us know that 500,000 people have died from COVID. We are close to have 30 million people infected. Yesterday, I was giving a talk yesterday, and because I have a Facebook Live that I give every Tuesday and Saturday. And yesterday was the first time that I when giving the stats were about 1,700 people die. 1,700 people die on March 12. It was the first time that I said that I knew one person directly who was a friend of mine who died from COVID. And it was really tough because I take care of patients. Yes, patient die. Yes, but it was the first time that I know somebody that I know the wife of a colleague of mine who died from COVID. So COVID has touched a lot of people. So next, I'd like to ask you how COVID has really touched you.
Wow. My condolences, and I do believe I know the person that you're speaking of, because I heard the news. I got the news yesterday.
You got the news too, yes, yeah.
Yeah, so I got the news yesterday.
Yeah.
And it was mind blowing. And you're right. The stats are right. 1 in 3. You know, for me, COVID has been. I don't know. I want to say, and I guess goosebumps, and I get all warm inside when I think about last year at this time. We had I had just gotten an honor from the Osteoplicus. I can never pronounce their name. Medical Society.
Asclepius.
Asclepius, yes. Medical Society, our organization. We got Lifetime Achievement Award. We were awarded that, and we had it was a huge event.
I was there. I was there.
I know anybody who was anybody in medicine and nursing, and you were Haitian American. That was the place to be. It was an amazing event.
Guess what? I'm one of the founding members of Asclepius. We started. We started Asclepius. We started.
Wait. I got to tag on the Facebook Live. I got to tag somebody because Nicole Francis. I want her to be watching this.
Yes, we started Asclepius. Asclepius started in the cafeteria of Downstate Medical Center.
Wow! And what year was that?
We were, I think, in the 80s. Yeah, in the 80s.
Wow.
We were medical students. We were hungry for knowledge, and we were studying like crazy to become part of the medical mainstream of the United States. So we usually sat together and then we studied together, and then from there, then Asclepius it was born.
Oh.
So
you were at that. You were there too.
Yes, I'm there every year because I'm a founding member. I'm a founding member. That Dr. Ewell Simon and all the others. Yeah, we the ones who really started. Dr. Mona Perville. So yeah, Dr. Valerie. So we the ones who started. We were a medical student. We were 30 and 40 medical students. And we started the organization. Yeah.
What a small world. You see that? You learn something new every day.
Yeah.
So we had just finished celebrating. A week later, we were in Washington, D.C. Dr. Ferrari was there and a number of others. We went to Washington, traveled back, not knowing that our lives would be changed forever and ever and ever. And somehow, between my travels of managing my patients in primary care, I remember specifically about a week before COVID touched me personally,
Wow.
I was seeing patients. And I kept getting these calls, so-and-so has a fever, so-and-so doesn't feel well. And I'm like, okay, all right. And I'm seeing patients. And I remember specifically, I'm not saying that's when I contracted it, but I remember specifically when dealing with, I went to a home to see one of my patients. And when I got there, he was in his bedroom, in bed. His window was open. It was cold out. And he was burning up. And I closed the window because I can't do cold at all. I can't take the cold. I like warm weather. And I went and I got a thermometer and I just scanned his forehead and it says 104. Mind you, his window was wide open. And then I said, he spoke Spanish. So I said a few words in my medical terminology, the bank of Spanish, which is very little. And I had him sit up so that I could listen to his chest. And while I'm touching him, no PPE on, no gloves on, and I'm listening, and something tells me, you should really be wearing a mask, I said to myself. And then I laid him down and I said to the young lady that was with him, I'm probably going to have to send him. I want him to go to the hospital because his breathing was horrible, was just horrible. So, they called 911. I sent him out to the hospital. And about 7 or 10 days later, I'm at the hospital myself and I'm feeling a little under the weather. So I go and I check my temp. I walk across to a treatment room and my temperature is like, at the start of the shift, like 100. But I push it away. I pop 2 Tylenol and I get my evening going. And about 11:30, I check my temperature again. It's like 102.7. And I am feeling pains in bones that I didn't even know I had. I was having so much bone pain. And I remember that night, my husband came and he picked me up. And I said to him, I feel awful. And he said, I hope you didn't go get yourself, you didn't contract anything. And I'm like, no, but I'm just not I'm not myself. So the following day I was tested and I get a call maybe a day after saying, you're positive, you have the coronavirus. I'm like, oh my gosh. So I'm still working remotely because schools at that time, they started to shut everything down. And I would get up, quarantine, everybody has left the house, no one's home, it's just me and my husband. Because they say you have COVID, people, stay away. And I kept getting on my computer, doing my lessons and doing my teaching. And one morning, my husband came to wake me up and I could not get up.
Wow.
And so I told him, can you, call such and such, call this, tell tell them that I'm not feeling well. I couldn't even use my fingers. And a good friend of mine, Virginia, called. And she said, Kay, don't you think you should go to the hospital? Knowing what was happening at the time at the hospitals, and she knew this herself, I was like, I'm not going to nobody's hospital. And then I thought about my mother, and I'm saying, if I'm sick and I'm in the hospital, my mother won't be able to see me. Not that she was able to see me when I was at home. I said, I'm not going to the hospital. And there was my demise. And it was a slippery slope. I remember some things and some things I don't remember. I remember being hooked up to IV. I remember people coming into the house and doing things for me in particular. Katie Santillis, Fleurette Cassius, Dr. Lubin from HAPA, all did their part. So many other people, and forgive me if I didn't mention your name. These people, after God and my spouse, helped to save my life.
Wow.
Now, if I had to do, and I was privileged. And I'm going to tell you why I was privileged. I was privileged because I had treatment brought to me. When I was knocked out and dehydrated because I had no sense of taste or smell and I couldn't eat, I couldn't do anything. I couldn't function. I was out of it, and I was hearing stories that I was picked up out of the tub and placed into bed. I was in a very, very bad place.
Wow.
And perhaps if to do it over again, would I have gone to the hospital? And when people that I know got sick, the first thing I tell them to do is go to the hospital. My breathing was not so wonderful, but thank God I didn't succumb to levels of colleagues. I have colleagues that I have lost, three in particular. I have colleagues who went into the hospital and suffered cardiac events and are no longer the same because of, anoxic encephalopathy. And so they will never practice nursing ever again. And so COVID has touched me.
Wow.
And it's not until I was telling somebody this, a friend yesterday, because people are starting up. People are, we're a year into this and we hear vaccines. And so people are back to what they think is really normal because the numbers are not what they were last year at this time.
Exactly.
But we are not out of the woods.
Exactly.
We are not out of the woods.
Yeah.
And people need to respect that. And people who never have been touched by the disease themselves will never know what it is. My mother, as I mentioned at the beginning, contracted COVID just before Thanksgiving and was hospitalized. And I had to elbow my way, and I'm telling you, elbow my way. I mean, I don't want, I want to share, but I want people to still feel, oh, things are not the way that they used to be.
Exactly.
So as healthcare providers, we were working and we didn't have the right supplies. They gave us one N95, they put it in a paper bag. And I don't want to say guilty of this, and I probably am because I'm an administrator. And so I was one of these people who were putting these N95 in a paper bag and giving to my nurses and say, you're not going to get another one until you can bring back the old nasty one, and then I'll give you a new one because we just didn't have.
Yeah.
And so many people got sick. I mean, I could have been the one. I have friends who brought illnesses home to their parent and lost the parent. I was lucky, and I was lucky to be alive to advocate for my mother because they took her and put her in a corner. And I went in there and I turned the place upside down, Dr. Benoit. And I don't like to tell people who I am and what I do and what I stand for and what I'm blah, blah, blah. I don't like to do that. Yeah. But in that case, when it came down to life and death, I said, oh, no. This lady is not going to come here and she is not going to drown in her own secretions. We are not just going to ventilate her or put her on a vent. We're going to try other methods. We're going to, and we're going to try to save her life. She was lucky because there are some who didn't meet her profile. She should not be here, but God said something else. There are younger folks, who just have mild asthma, got COVID, and they're not with us. So COVID has touched me. And I'm not the same person that I used to be because I see things through a COVID lens. Anyone who COVID has touched, you are seeing things through a different lens, whether you had it, whether you lost a loved one,
Yeah.
My taste isn't back. I still struggle with getting myself enough, fluids in, and I'll go to the doctor and they'll say you dehydrated, you need to drink enough, and I'm keep saying like I'm really trying, but water just tastes, for me, water tastes like milk. It's the same feeling. I'm an active, athletic person. Before getting COVID, I came down in size. I was much heavier. And I just said, I gotta, turn my life around. I'm getting older. I need to shed some of this weight. And I was able to do so. And I'm thinking to myself, maybe if I were heavier, it wouldn't have hit me. So I don't know. I'm just coming up with,
Yeah.
Haitians, they'd be like, oh, you don't have meat on your bones. That's why you got sick. And which is no scientific evidence behind that at all. But again, until, it touches you, some days I'm fine. And then some days I wake up, I have to use an inhaler. I've never had asthma,
Wow.
never had respiratory problems. And then it reminds me, you're a COVID survivor, girl. And some days I can get up and I can run a marathon. Some days, I teach. Some days I get up and I have my lesson plan planned out, and it's as if I'm sitting at the computer and there's a fog there, like I'm in a fog.
Yeah.
And somebody said to me, you mimic the literature. There's something they're talking about, a COVID fog, and how it affects some people neurologically. And so little by little, I'm seeing these. I have strange blood dyscrasias. So I'm not 100% where I don't think I'll ever be health-wise the pre-COVID. But I am much better, and much of my success, and I'm going to say this, was rooted in herbal remedies, Haitian remedies that my husband concocted. Some things he bought me to drink, I thought it was gasoline because it tastes so horrible. It would burn my. I'm like, what is this? Is it gasoline? It's horrible. But a lot of teas, when I could stand up, vaporing. Again, a lot of herbal, additioning and adding to that the traditional Western, medicines. So I did the azithromax. I did it twice. I did the hydrochloroquine. I'm sorry, I can never pronounce that name. I did that, when the roads were starting to get slippery and it wasn't looking too good. And they're telling me, and I'm like, I don't do that. I don't want, and I was saying, I don't want to try that. They said, try it. Like, you have nothing else to lose. Maybe your life. And there was a point where I was yay close to going to the hospital, being brought, not even, going willingly, but being carried to the hospital. And I begged my husband, I said, at least if I die here, you can come, my mother can look at me through the door, like you can crack the door and have her look at me. If you take me to, oh God.
Wow. Okay.
If you take
what a
me
story.
to the hospital,
What a story you're telling us. Wow.
That was my main concern. Wow. I said, the boys, they have pictures, they have videos, they can look at my phone, they'll miss me, I'm sure. But if I'm gonna leave this earth before my mother, don't take me to a hospital.
Wow.
I'm not saying if you're sick, folks, please listen. If you're sick, get tested.
Yes.
You're febrile, get tested. You need to get tested. Right now, and don't wait till you get worse before you go out and get tested. And those same measures that saved many people's lives, we still have to institute, because we have to understand our community has been hit more proportionately than our white counterparts.
Definitely, yeah.
I mean, and that's the reality. So anyone, many people have those who COVID has touched, and it's real. It is as we plan and we get together. please take those precautions. And just because you feel good and you look good, you don't feel sick, it doesn't mean that you can't be carrying it.
Exactly.
Especially if you've known you've been exposed. So get tested and take measures to keep other people safe. That's
correct. That's correct. And you said it's so it is so true. Our community has been afflicted much more than the white community. And the problem we have in the community, there's a lot of misconception about COVID and the treatment of COVID. Now, before we go to the treatment, talking about the vaccination, but there's something else you mentioned, which is correct. We're not yet out of the woods yet, because if you look at the numbers, the stats tells you that for the past 2 weeks, the number of cases have been plateaued. We are close to 60 to 70,000 cases a day. And yesterday, we had close about 1,800 people died. The day before, 700 people died. So COVID is still there. Now, the reason why this plateau is so worrisome, because as we all know, we have the variants, and the variants they don't have any clear treatment for them, because none of the vaccine have been shown very efficacious toward the variants except the JJ vaccine. Now, question for you. I've been vaccinated, and I've done it because the reason why I've been vaccinated, and I did it live, because when they stopped talking about vaccine, and I told my audience, I said, let me tell you, the minute the vaccine is out, if I look at the study, if I look at the numbers make sense, I will be taking my vaccine live so you can see. So I took my first shot, I think it was beginning of January, and I took my last shot January 28th. And I kept my audience aware I was feeling. As a matter of fact, I felt much better after the vaccine than before. I have more energy. It's a rejuvenation for me. Yeah? So I took the Pfizer vaccine. So, but you see, the community is still perplexed about the vaccine, because people said that they're putting chips on the vaccine. The vaccine, it's a way to control population. What has been your experience with the vaccine for you?
So I have to be totally transparent and in saying I have not yet been vaccinated.
Okay.
So that's first. I have not yet been vaccinated, and like you, when I do get vaccinated, because for certain people, I think we need to have a level of transparency. And when that time comes, as a matter of fact, I reached out to my provider the other day, and I realized she did not respond to my text. So if you're watching on the live, please go back. And I asked, do you have the vaccine yet? And the minute that they tell me they do have it, I'm going to get vaccinated. I myself was on the fence because I felt like, why is this vaccine? How did this vaccine come out so quickly? You know, the United States doesn't have the best history when it comes to trust and the Black community and vaccination. The United States doesn't have the best history when it comes to trust, and even overseas in the Caribs, what they're willing to do in order to test certain theories. And I don't need to talk about different projects and different scientific experiments. We all know, we can, look it up. So those things, they troubled me. And then again, these ideas of conspiracy theories and population control. It is not until I believe the Haitian Alliance, because I don't want to mess it up, I would have to look it up, but they do something once a week on a Monday or Tuesday, and where they live stream and they talk about COVID, the community, etc. And one of the providers there gave an analogy that I use now about COVID, these bullets, and there's these new bullets out there, and you're getting shot. And if you go outside, you can risk getting fatally wounded by this bullet. But if you arm yourself with this bulletproof vest, i.e. a vaccination, you have it, because the vaccines, as you know, they're not 100%.
That's correct. Yeah.
And even if you think about it, you have small children, you take them for immunization and you get them the varicella vaccine, that doesn't mean they're not going to get the chickenpox. They probably still get chickenpox if exposed. They just have milder symptoms. So put the bulletproof vest on and take your chances, or don't put a bulletproof vest on and take your chances. So I would rather arm myself with this bulletproof vest. Because I'd rather have 67 to 87 or 82%, where I don't remember what the stats are, as opposed to having 0% and getting shot.
Exactly.
And nobody says that you had COVID and you can't get it again, because I can't tell you how many times I've tested positive after being exposed for the first time. And so on my last positive, I sat home twiddling my fingers because they put me out of work, and I had to just stay home for a whole 10 days. So as soon as that's available, I'm going to do it. But I have a number of colleagues who I keep calling them my heroes, members of my organization who proudly go, they get vaccinated, they post the pictures, and like you, I'm going to do mine live as well.
That's good.
And I'm going to keep the community abreast, of how I'm feeling, and really share the experience, because I am to live as an example. Like I can't be sitting in this chair, you're telling people to get vaccinated, and you have yet to be vaccinated.
Exactly.
No.
Exactly.
You don't really want to do it anyway. But you have to live by example. And then again, that speaks to that level of credibility that, as living as this example for your members, for your children, for your family. My mom's going to get vaccinated. And she's 84 years old. So why wouldn't I get vaccinated?
Exactly.
That's important.
So I think that that will propel a lot of Haitians who are still skeptical about the vaccination, because many times they are listening to, they go on Google, they go on Facebook, they go on all kind of on social medias and get their knowledge. So I think that we covered quite a lot today, and I think
so too.
And I think it was very, very interesting. Before we depart, do you have your final words to say? Anything you'd like to
add? I think that we are living in, I will share this, in epic times. Like the way that we lived our lives in the past has evolved, right? So, I mean, I'm sitting here, I'm in my home office, I'm looking at my desk. I have N95, I have a regular surgical mask. I have cloth mask, all on my desk, cloth mask, because even if somebody comes in to see you, you have, even loved ones that you haven't seen in a minute, you have to have them put their mask on and stay, give you 5 feet, give you that personal space that you're entitled to. our lives are not going to be the same. And I think that under this storm and in this under this what we're weathering now, I think it's important for people to understand to gain some sort of normalcy may mean we need to be vaccinated.
That's correct.
Does it mean that there won't be variants? Viruses are very, very smart. They evolve.
Yeah.
They're smart. But at least if you have that initial exposure, you put yourself in a better place. Don't let COVID touch you. Definitely not how it's touched me, not how it has touched others who are not here to share their story, because there are stories that can be told. I just feel privileged to be alive. I feel privileged to have the opportunity for Women's Her Story Month to share my story with all those who are listening tonight. I'm privileged to share my passion of nursing education, and my passion of HANA, the Haitian American Nurses Association. I invite you to visit us on our website, hanainc.org.
I will.
hanainc.org,
Okay.
and see how you can contribute to making a difference. This is me asking for money. Because without that, we can't do the work that I can't possibly fund it. That would be a bad leader funding her own organization. But we need your help. I'm so blessed to have the opportunity to have met you, Dr. Benoit.
Likewise.
Robbie, for having me on. It was an amazing experience.
Yes, likewise. Likewise. And Kay, if I can say K to K, I think that you should write a book.
You think so?
Yep. You have a beautiful story that you can sell. Beautiful book. Wow. And I'll be the first one to buy it.
Okay. All right. Guess what? You're going to be, hopefully we'll be in a better place. And when that book ever comes out, and I'm going to take you up on that, you'll be at my book signing. How's that?
Yes. Yeah, it's a beautiful story. I really enjoyed the conversation.
Thank you so much, Dr. Benoit. Thank you.
I wish you continued success, and I wish that your story has uplifted a lot of young Black women, a lot of women tonight, because you see, your life story has converged two things. First, it converged your perseverance and resiliency in all aspects at a young age and at a more mature age. You survive COVID and you survive all the tribulation of life. And today you're a successful person. And I think that is quite an admiration. And it was a pleasure.
Thank you so much.
It was a pleasure.
Thank you for having me.
And hopefully we'll meet face to face one day.
Hopefully. Yes. And maybe you think when that meeting comes, we won't have to wear a mask?
No. Definitely not. Oh. Okay, Kay. Okay, good night.
Thank you so much, Dr. V. Thank you. Have a good night.
Good night.
I never found someone like you.